Health condition is challenging at any age. Imagine you're a parent and your toddler is diagnosed with type 1 diabetes.
Yeah, an autoimmune response, it often comes on quickly and it can be hard to control. Wink News health and medical reporter Amy Osher has more on what to look out for.
Do a spin.
At 2 years old, Rosie Perez likes to prance and pose. What sets her apart from other little girls are the accessories she wears 24 hours a day.
This one administers her insulin, and then this is the one that is always constantly checking her numbers.
At 10 months old, Rosie experienced a major health scare after a night of severe vomiting.
And then all of a sudden, it was like a light switch.
By the time she got to the hospital, Rosie was in crisis.
Her initial blood sugar was 699, and she was in diabetic ketoacidosis.
Diagnosed with type 1 diabetes, her pancreas doesn't make insulin, leading to high blood sugar. With no family history, it came as a shock. Pediatric endocrinologist Ashad Khan says there are signs to look out for.
If a child is peeing a lot and drinking a lot and losing weight, then you'd be a little bit more concerned about diabetes.
You can smell sugar sometimes on the breath of a child?
Right. So it's actually you're smelling the ketones.
To control blood sugar, the little girl needs insulin for the rest of her life. Dosing is harder to manage in kids her age.
Used to call it brittle diabetes. It's not a term we use anymore, but it essentially makes the point that the younger the child, the more variance and up and down blood sugars drop fast.
Things like outside in the heat, that really affects her. There's been times where she's playing outside at the playground and all of a sudden she's as low as 30.
The blood monitor and insulin pump are working.
She actually is in gymnastics already at age 2 and she loves it.
But the family would like an added layer of protection. A diabetic alert dog.
Her dog will be able to alert us when her sugar is too high or too low.
Using a combination of treatments, they hope to give Rosie the freedom to move and grow. Amy Osher, Wink News.
Amy, thanks. Now, Rosie is younger than most kids who get diagnosed with type 1 diabetes. The most common ages are between 4 and 7, and then again between 10 and 14 years old.